Most times we're talking about painful ovulation or women getting pain during sex. So let's turn the tables today and ask, do boys get sperm pain? Now, this is also known as painful ejaculation. And yes, absolutely, boys get sperm pain. It may be mild or more severe from one guy to the other, but whichever the case, it's important to get it checked out and find out what is responsible. So this video looks at painful ejaculation and what it could mean if this condition happens. I am Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. On this channel, we discuss health information to help you feel and be better. So if this is right up your street, please like this video, consider subscribing to the channel. And when you've done that, please go ahead and follow me on social media, Instagram, Facebook, Twitter as @AskAwayHealth. Now, what is painful ejaculation? Painful ejaculation is when a man feels pain along any part of his genital organs during or before ejaculation. Now, the parts of a man's genital organs are many, and they include the prostate. This is a small gland that surrounds the tube that carries urine out of the body. The prostate gland produces a thick white fluid that mixes with the sperm to form semen. Next, the testicles. The testicles are oval organs found in the scrotum behind the penis where sperm is produced. Next, epididymis. This structure is found at the back of each testis, and it is where the sperm are left or stored to mature and develop. Next, the vas deferens, and this is a tube that connects the testes with the urethra. So it is the channel that sperm and semen is moved from the testes into the urethra and the penis. The seminal vesicles are coiled tubes lying behind the bladder, and they contribute towards developing the semen. Men also have ejaculatory ducts where there is more mixing and storage of sperm and seminal fluid before ejaculation happens. And they also have glands which contribute to lubricating the tissues and the structures through which all these material go through. So a problem along any of these tissues or structures can lead to painful ejaculation. Now, painful ejaculation may be a common event. The problem is that we don't really know, because many men feel embarrassed about talking about this, so we can't put it into numbers. Some estimates suggest it may be as common as 1 in 10 men or 1 in every 100 men. There are men with certain conditions who are more likely to experience painful ejaculation. Some of them have problems with their prostate gland, for example, benign prostatic hyperplasia or BPH. This is a condition where a man's prostate gland, remember we talked about it at the beginning, it gradually grows bigger as they grow older. It's not the same as prostate cancer, but if it happens, it can cause some distressing problems in some men. Another group of men who may have a higher risk of developing painful ejaculation are those that have difficulty with passing urine. This can include passing urine frequently, having a sudden need, desperate need to go and pass urine straight away that they cannot hold, or being unable to control their bladder, that is, wetting themselves or having accidents. But outside of these conditions, what are the causes of painful ejaculation? Before I tell you, let's address a common inquiry. Is it normal to experience pain during ejaculation? Ejaculation is the release of semen from a man's penis at the time of orgasm during sexual activity. Ejaculation happens under the control of the nerves, the blood circulation, the brain and hormones, and the different tissues we've talked about already. And usually it is a painless event, generally associated with pleasure and satisfaction. But in painful ejaculation, some of the symptoms that men complain about include a sensation of burning when they are coming or ejaculating, experiencing a dull pain when ejaculating. Some men may feel a sharp pain during ejaculation. There could be other features like pain during ejaculation to one side of the body or the other. Some may have painful ejaculation and painful urination. Others have pain during ejaculation but not when urinating. Another symptom is pain during ejaculation with blood from the penis. So now, what causes pain on ejaculation? First, infection. What types of infection can cause painful ejaculation? This could happen from sexually transmitted infections. Pain with ejaculation may be accompanied by other symptoms like a bloody discharge from the penis. Some of these types of infections are gonorrhea, trichomoniasis, or chlamydia, and so on. The other condition that is related to infection is known as prostatitis. Prostatitis is inflammation of the prostate gland. Yes, the prostate gland again. Often, prostatitis is caused by bacterial infection that can be acute or chronic. It is not always sexually transmitted, and sometimes you could have chronic prostatitis that is not because of a bacterial infection. Regardless, prostatitis, whether acute or chronic, can lead to painful ejaculation. And some conditions where a man may be more likely to develop prostatitis are if he's having anal sex, if he's got a weak immune system, or if he has a condition like diabetes mellitus. Number 2, drugs. What medications would cause painful ejaculation? Some drugs lead to painful ejaculation and erectile problems as a side effect, and they include certain antidepressant drugs. Typical examples in this category of drugs include the SSRIs, the SNRIs, or the tricyclic antidepressants, or TCAs. The third cause is if there is a blockage in the ejaculatory duct or any of the channels through which sperm and semen pass through from the testes to the penis during ejaculation. The blockage could be because of stones or cysts that develop within the channels. They will prevent the free flow of semen and can potentially lead to infertility as well as painful ejaculation. The fourth reason is surgery or radiotherapy. Treatment like radiotherapy for prostate cancer, for example, can temporarily cause painful ejaculation as a side effect. And similarly, a man who has surgery for prostate cancer where some of the prostate gland is removed may experience painful ejaculation or other erectile problems as a complication of that surgery. Another type of surgery where this complication could potentially develop is following hernia repair. Damage to nerves and muscles around the pelvis can lead to pain around the genitals, the rectum, and the anus. This can result in pain during orgasm or afterwards in men. In particular, men with diabetes mellitus or multiple sclerosis or who've had trauma or injury to the pelvic area are more at risk of developing damage to their nerves. Number 6, psychological causes. In this case, we cannot find an obvious physical cause. And when the man masturbates, he does not experience a painful ejaculation, and so it is thought that this may be some emotional problem, in which case it is good to speak to a therapist to help to work out what may be wrong. So these are some of the common causes of sperm pain, and if you experience painful ejaculation, it's important to get it looked into. This can help us identify the cause so that you get the appropriate treatment. The treatment will depend on the cause, and it should settle down once that cause is addressed. Thank you so much for watching. Let me know if you found this helpful, if you've experienced sperm pain before, or whether this is a complete surprise that such a thing actually exists. And if you found this video useful, I think you'll enjoy watching this one as well. Remember to give this video a like and subscribe to the channel. I'll see you again soon.